Okay, a few weeks ago, months ago maybe, I had somebody ask me to cover Myxedema coma, which is a life-threatening medical emergency from untreated hypothyroidism. And these patients come in, and they can appear like really any other kind of hypotensive situation. So people oftentimes think it's sepsis or a heart failure exacerbation, those kinds of things, because the patient's going to be extremely bradycardic, extremely hypotensive. For a little bit, they'll be fluid responsive, like all of those disease states. If they're able to communicate with you, they're gonna exhibit all the signs of hypothyroidism. So, extreme fatigue, a hair loss, brittle nails, all of those kinds of things that hypothyroid patients have. But then when you start to treat that hypotension and you start to treat that bradycardia with fluids and pressors and those kinds of things, it doesn't work. And so then you'll check a TSH. You'll see that it's through the roof. If you do have the capabilities at your facility to check a free thyroid hormone level, T3, T4, you'll see that it's extremely low. And so those patients, we will treat directly with IV levothyroxine. So directly with IV T4. There is T3, which is the active thyroid hormone. T4 has to be converted to T3. T3 is the active thyroid hormone. Having said that, T3 is not as commonly available. It's a lot more expensive. It's really just not necessary. And so IV levothyroxine is really the gold standard for treatment. And then you should also give the patients steroids if it's higher up, if it's adrenal insufficiency, like from a pituitary tumor or whatever, that will also cause a TSH to be elevated, and that will also cause thyroid imbalance. But treating with T4 alone won't fix it. And so oftentimes you'll give those patients high dose stress dose steroids too, like 50 to 100 milligrams of hydrocortisone every 8 hours. And so again, these are patients that come in, their symptoms mimic lots of different things. So it's a question and answer thing. Like, have you ever had anybody tell you you're hyperthyroid? Have you maybe been non-compliant with your thyroid medicine? And then after you start to treat the bradycardia and hypotension and it doesn't work, you're like, this is weird. And so then those patients, like I said, require high dose IV levothyroxine. It can be like 200 micrograms daily for several days to get it back up. And then also a dose of hydrocortisone. So I hope that's helpful for myxedema coma.